The impact of the stockout of one commodity is felt not just within the realm of that one commodity, but across all the other commodities, and therefore the impact spans the whole healthcare system and not just for that one commodity that is missing. Ladies and gentlemen, therefore, an integrated system that can be able to deliver on all of our health mandate is key, really, to get us to achieve objectives.
Most of supply chains in developing countries are described in the form of a spaghetti diagram, and it looks like this. This was once KEMSA's supply chain. But this is the story of most health supply chains in many developing countries. It's different donors doing different things, disconnected, they don't talk to each other, the donors themselves. Then you come to the health agencies who are supporting the response. Then you come to the government also, who are also sort of fragmented. You know, supply chain is not even part of the equation. So how can we achieve our goal? Which is why today we want to discuss about integration.
Bring the players together, of course discuss about the results of the survey, then develop a roadmap of the integration. Then of course, I mean, you are not saying that integrate straight away, so you have to do it in a scaled up approach.
The spaghetti diagrams that were there, just to sort of reference those earlier, would that be something that you would, like a tool that you might use to at least start that process?
Yeah, the various points of procurement, the various points of warehousing, distribution. So then you'll be able to bring all those players, because they were defined. I mean, there was GTZ, KFW, USAID, you bring them together. And that's what we did, especially for HIV, nutrition, you have done that, and other programs are following suit.
Technically, sometimes we are very good, but as a person, as a manager in the supply chain, it is not enough for you if you don't know how to manage people. Some of you spend 80% of your time managing people other than managing the process. True or not true? So you need to have a bit of people management. You need to understand about drug quantification processes. You need to also understand financial management, so that as a supply chain manager, you have also an understanding of how these other factors that seem like they are external can interact with you as well, so that we can have efficient supply systems.
Up to which extent is good to integrate in this country or in other countries? We'll see. Well, it's an open question. But also, where do we want to integrate? Do we want to integrate at commodities level among different programs? Do we want to integrate at transport level only, which is something that is happening, for instance, through KEMSA with some of the programs? Do we want to have integration in terms of teams? But also, what are the expectations? It's likely that one supply chain is more advanced. So, as a matter of principle, we should integrate a different program, a different kind of commodities. But who's going to lose? The more efficient supply chain probably is going to lose something, while the other is going to win something. So these are expectations that we cannot give for granted.
As we discuss about integration, our concern is to get the commodities to the end user. But at times we know we end up with expiries in the field, and we know it's been quite a challenge on how to, get those back to the central medical store for, safe destruction.
In Kenya, before we used to have a push system, now is a pull system. All the counties are pulling that which they think they will be able to consume. So in Kenya, in terms of expiries, it will reduce drastically because of the pull system.
So what comes with that is that for the next 2 years, whenever PSA will run training anywhere, NMSF will be able to send 2 nominees to attend our training free of charge.